Hey, my name is Dr. Brendan McCarthy. Thank you for tuning into my podcast. I'm the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. For now, I might be moving. Again, I'll let you know when we do. Maybe even move out of here. I'm filming in my house for a year and a half now, almost. We first started doing it in the office, and then the office was just too many things going on in the office. People be wanting to room a patient in the room right next door. You'd hear it, and then, so we figured it'd be better to start filming here at my house. And then my wife is like, why don't you keep work at work? We'll bring home at home. So we might be relocating with everything in the near future. So I'll keep you posted. But new things today, in today's episode, I don't know if you guys noticed, I'm in a new chair. I was using the living room chair for a while. Again, my wife's like, why don't you just get a chair in the library for you to do your podcast instead of grabbing the chair from the living room all the time. So I went and splurged on a chair yesterday, and we're doing a different mic setup. So because my hands kind of go, so we're going to see how this works. Lots of new things. With all that put in, if you wouldn't mind, take a moment, click down below to subscribe, and then we'll get started with today's episode. Today brings me to a topic that I have been wanting to discuss for a year or plus, and it's a very personal thing. And it's been something that I've been not sure how to bring up. There's a bunch of things that Justin and I discuss on our future, like what are we going to do next? Where are we moving to? What's the plan with this podcast? What can we talk about next? This has been in the plan for a while, as I mentioned. It's just very personal. It's very personal. Why I'm bringing it up now is I had a woman share one of my reels, and she put in there that she was thankful for a trauma-informed physician taking on these subjects. I never thought of that term, trauma-informed. I just don't. I live in my own little enclave. I own my own little world, and I never thought of myself as a trauma-informed physician. When she wrote that struck me deeply. Because I just never considered it, but I realized that is a lot of what I do. To me, being a trauma-informed physician means that I understand the role trauma plays in my patients. And to me, it means a little bit more is that I actively approach my patients with the understanding that trauma can be present and could be a significant contributor to the pathology that they've come to see me for. Being a trauma-informed physician is not automatic. When you go to medical school, we learn algorithms of diagnosis. We learn, how the body works and why it does what it does. We understand all of these things. We also learn that people, who have adverse childhood events will go on to have certain pathologies with life. Just knowing that does not make you trauma-informed. I think there's a certain amount of empathy and a certain amount of care that you need to develop in order to become trauma-informed. I think what makes me a successful physician, and I measure success in the relationships I have with my patients. That's it. My success is always down to that relationship with my patients, the work that I do in that moment with that person. Not just that moment, rather, but the long-term work that I do with my patients. That relationship is my success. It's not a number. It never will be a number. It's the work that I do and the quality of work that I do. That is success to me. And what has brought me this level of success is the ability to navigate with my patients through the cause of their pathology, the underlying cause. And often, as I mentioned, that is trauma. The thing is that treating hormones and understanding trauma go hand in hand. You can't understand one without the other. And it's so important to relay that with you, because you'll go to your doctor with anxiety, and it is linked to your not having a cycle, a normal cycle. Say your progesterone is low and you have anxiety because of low progesterone. I can go in there and I can treat that progesterone and I can get it going back up again. But it doesn't always solve the problem because there's more to it. There's more behind it. Your thyroid. You may present with thyroid disorder. And I can see in there that reverse T3 is elevated, and that's secondary to significant stress in your life. I can fix your thyroid. But I'm not a good doctor unless I understood this part too. I could not be a good doctor if I only treated just the little piece that's in front of me here without trying to understand this other piece here. So I'm going to make a series of videos now over the next few weeks. And they're going to go over the role trauma plays in different aspects of your endocrine health. We're going to talk about how the initial trauma that you experience, how that dysregulates neurological tissue and the balance of neurotransmitters. We're going to talk about how that imbalance of neurotransmitters and processing, neural processing of events around you contributes to dysregulated adrenal function. That means your cortisol is going to be irregular. We're talking about how that irregularity of cortisol impacts your ability to ovulate, causing you to have fertility issues, causing you to have anxiety due to low progesterone, insomnia, depression, all of these low progesterone. We're going to talk about how this dysregulation and how trauma and how through that affects through the cortisol affects your fasting insulin levels. We're talking about how it causes weight gain. We're going to talk about how it affects thyroid function, how it upregulates reverse T3, which blocks normal thyroid function. Another area where people get, it's hard to see the line with this, but there's a line. How adverse childhood events affect our ability to consolidate memories appropriately. How trauma will lead towards brain fog, something you would experience as brain fog, the inability to think clearly, and consolidate memories in a way that helps you kind of navigate through your day. My overall goal is to help create a more balanced approach to your care and to educate you about that balanced approach. So that way you can advocate for it for yourself in your clinic when you see your physician. Not every doctor thinks this way. I know. And I realize I live in my own little bubble. I practice in my own bubble. I work with 7 amazing physicians who I love, and they're close, and I care about them dearly. And we all practice like this. This is how we think. This is how we view the world. So I just talk to them every day, and I think this is just how medicine is practiced because I live in my own little bubble. And the more I talk to my patients, the more I talk to my friends and people that I've met throughout my life and online, you guys are huge to me. And the more I realize this is not being done. So I'm going to share that with you. And I'm not only going to share it, just this is my opinion, I will give you the research. I will give you the science. Because it's one thing to hear my opinion. It's another thing to hear where I got my opinion. So that way you can access that information as well. Think about it and see whether that's something that you would like to use as well in your care. Not everyone wants to go to therapy. Not everyone wants to deal with trauma. I know. But that doesn't mean I shouldn't do my best to give you that information so that when the time comes and you are ready, you have that. So that's what I want to be there for you. Throughout time, these videos are going to be online forever. They're here for you. When you're ready, you take that step. So I look forward to the next few weeks of these videos with you. I look forward to the exploration of your health and this whole nother aspect. I look forward to your feedback. That's another thing I say at every episode, but I mean it. Justin and I read your comments. We really do. And they mean a lot. And I use that to help drive this podcast. This whole series I'm putting out is due to a comment. So please do like, subscribe, and share and comment. Another thing that happens when you guys make comments, if you look at the Instagram page, somewhat YouTube, but mostly Instagram, you can see women talking to each other in the comment section of a reel. I got nothing to do with that. And I see them encouraging one another and I see them nurturing one another. That is a true community. So I thank you for your participation there as well. If you haven't participated there in the past, please consider participating now, because your input, women need to hear your take on things. And what you may share there may be a woman who's experiencing the same thing as you. Sometimes a burden shared is a burden to have. That's an old-fashioned saying. So thank you so much for tuning in. I look forward to seeing you at the next episode.